Welcome back to the Hand to Shoulder Solution, giving pain the middle finger. Thank you for liking and for subscribing, and also thank you for sharing these videos with people who you might know are experiencing stiffness, pain, lack of use of their arm. This is great information. What I'm working on doing is providing you with shorter, more concise videos that so you can take pieces of information and use those to your benefit. Again, this isn't treatment or treatment advice. This is information sharing to empower you to realize when and where you need to go to get the services that you need. As an occupational therapist and a board certified hand therapist, I work to rehabilitate orthopedic conditions affecting the fingertips through the shoulder. Today, I want to talk about stiffness. There's a lot of reasons for stiffness, whether a person just got out of a cast, perhaps they just had a fracture or a broken bone, or they just had to have surgery to repair tendons and or nerves, or they had an injury and they've just been learning to use their hand a little bit less while they are healing. Stiffness can occur quickly, and it can be very frustrating for people to regain their movement. Also, what happens when the joints and the soft tissues like the skin and the tendons, which connect muscle to bone, and the muscles themselves, and also scar tissue contracts, it shrinks and tightens. When they get to their end range of motion, it sometimes can be very painful as well. In the clinic, we teach people very specific techniques for restoring the range of motion so that the range of motion is being done safely and most efficiently. Also, I always stress to patients that the range of motion cannot be done continuously. So a lot of patients will come into the clinic and they're just, they're attempting to keep it loose and they're moving all the time. They're always trying to loosen it up. And the assumption often is that more is better. However, we're dealing with living tissue. And it's this living tissue that has to be given the opportunity to rest. It's sort of like watering plants. You have to water the plants, but you can't water them all day long. The rest period is as important as the exercise or the stretches or anything that's being done. Otherwise, you're going to increase inflammation, increase pain, and actually make it more stiff. Also, with stretches, if you push too hard, remember this is living tissue. If you push too hard on the tissues go into what's called a stretch reflex, and they actually pull back, they actually contract, and that will actually increase the stiffness. So some basic stretches. So let's talk about a fracture, the end of the radius bone when somebody falls on an outstretched hand. And this was a recent video that I did, and this fractures, and a person needs surgery. If the person has a surgery with plates and screws, I usually start moving these folks within about a week after surgery, 1 week, and we do very gentle active motion where the patient is moving on their own, and there are certain positions where it puts less stress on the bones. So as the elbow bends and they turn their hand palm facing palm up or palm facing them, that's an easier way to turn the hand palm up. Reaching out and turning a palm down, which if you think about it, that's a normal action because we reach for things, we turn our hand palm down. So elbow extension, straightening the elbow, turning it palm down, and that's reintroducing motion. Remember, this is about a week after surgery, and then stabilizing below the wrist and flexing and extending. So normal mechanics is when you bend the wrist down, the fingers extend or they straighten. When it comes up, the fingers flex or they bend. So straighten, bend, straighten, bend, and then side to side. So I tell patients the wrist moves, think of a plus sign, goes down and up, and also side to side. And then to reduce swelling, I'll have patients bring their hand right up above their head. I tell them to look at their hand, slowly close and open their fist, and just start with about 12 of those. If you're swollen, the best way to keep it elevated is keep your hand above your heart. So when you're walking, if you just bend your elbow, lay your hand on your chest, it keeps your hand above your heart. Super easy. When I tell my patients when they're watching TV and they're sitting down, you stack up some bed pillows on the armrest and just have the hand up here above their heart. When they're in bed, the whole body is horizontal. I tell them just be comfortable, get some sleep. More often than not, I have them in a this custom brace that they can wear to stabilize any fractures or any problems that they're having. Now, let's say a patient just got out of a cast. Let's say they had a fracture or a broken bone, and they did not need surgery. And now it's been immobilized for 6 weeks. That's a long time, a month and a half of immobilization, which needs to be done. The fracture now is healed. Now they get out of the cast, we need to get them moving. So there's something called active assisted range of motion where if, say, for example, the patient can't turn their hand palm up, I'll have them activate the correct muscles while they use what's called a clamp grip, and they get here at the end of the forearm, because that's where it's the forearm bone. People are usually surprised to see this. When you turn it palm down, the radius is now flipped over the top of the ulna. When you turn it palm up, the radius is now parallel with the ulna. Palm down, palm up. And that's happening in the forearm joint. That forearm muscle, there's a thick, heavy ligament between these two bones. When that shrinks up too much, it's almost impossible to regain the range of motion. So right when they get out of the cast, we get the person moving, and I'll have them stretch usually every 2 to 3 hours. So every 2 hours is roughly 6 times a day. Every 3 hours is roughly 4 times per day. So here's the technique. All of them turn it palm up. While they're working on using their own muscle power to turn it palm up, they come in with a clamp grip right here, and they're turning it like that until they feel a light stretch, just like when you touch your toes and you feel it pulling your hamstrings. That's a pulling sensation. You just want to go to that. You don't want to cause pain. If you're causing pain, you're just being too aggressive. It's going to increase inflammation. It's going to, cause other problems and perhaps also make it even more stiff. So you're going to hold it for about 10 or 20 seconds, then end this. Watch this. This is clever. You end with a place and hold exercise. So after the stretch, you hold it for 3, 1 and 2 and 3, and then relax. That gets the muscles pulling to the end range of motion, that retrains the muscles. So your active muscle control matches your flexibility as you regain flexibility. So that's one technique. Another thing, turning it palm down, that's tough too. So I'll have patients just go over the top. So they're grabbing their ulna here, and I show them on the model in the office. They grab their ulna, and then they push the radius bone down, and they're stretching it down in that manner. So here, you go over the top, they're grabbing the pinky side of the forearm and then pushing down with the heel of their palm on the backside of the radius bone. They're turning a palm down. Again, they're holding a stretch, 10 or 20 seconds, place and hold for 3 seconds, and relax. They do 2 rounds of that every 2 or 3 hours. Some patients, for various reasons, all of them only do it 3 times per day. Other patients, every 2 to 3 hours. And I write this out. More often than not, what I do is use a patient's cell phone to take a video of their stretches with their cell phone so they can reference it later. Now the wrist gets, everything gets really tight. There's so many ligaments which connect bone to bone. There's so many tendons which connect muscle to bone. There's 24 ligaments in the wrist. There's 24 tendons connecting the muscles to the bone that go across the wrist. So there's a lot going on. So a lot of times what a lot of people do is lean their elbow into their thigh, palm down over the top of the knee, and then they bend their wrist down and then just push on the back of their hand. They let the fingers be free. That's a separate stretch to stretch these long finger extensors. But let's just talk about the wrist joints, okay? So you're resting the tip of the elbow into the thigh, you're bending the hand down and pushing on the back of the wrist. And then another one is to flip it over because it has to go the other way too and go over the knee. Some people prefer to go over the edge of a table. Um, there's various techniques. Now, when people have a hard time turning it palm up or turning it palm down, I'll have them use the side of the knee. So they can come in here on the side of the thigh, go around the knee, and push here. So fingers are always out straight when you're stretching the wrist, okay? So when you're coming back and pushing it like this, and then toward the palm on the outside of the knee, come here and bend that wrist. Now, watch this. Here's some basic mechanics of the wrist and fingers. So the muscles that do this are here. The muscles that do this are here. The muscles that do this are here on the back. The muscles that do this are here on the back. The tendons cross the wrist. So think of it like a pulley system almost. So if I just let my hand flop down like this, my fingers automatically straighten because now these tendons, which connect the muscles to the bone that go to the fingers, are pulled tight because they're pulled around the back of the wrist, okay? Now when I flop it back this way, my fingers naturally bend, and because now they're pulled taut over the front of the wrist. Now, if I want to stretch those tendons, because if I look at I always compare it to the opposite side in the clinic. So all of them make a fist. And then this side bends that much because those tendons connecting these muscles to the tips of the fingers are flexible like they should be. Now, after the patient's been in a cast for quite a while, and then they bend this side, oh, that is really tight. So have them just simply grab their fist and bend it down to a light sustained stretch. And then a lot of times coming back like this, that'll be nice and flexible. And then this, pretty stiff. And that's where this one is being involved in the stretch that I showed you previously. Anyway, so these things need to be taken into consideration. It's very important that you be seen by a hand therapist that can thoroughly assess this and then give you the most optimal stretches for you. And what I like to do in the clinic, as I mentioned, is use the patient's telephone to do a video on their phone so they can reference their stretches. Thank you very much for watching. Thank you for sharing this. Thank you for supporting the channel. Thank you for subscribing.